We are very pleased to have with us today Dr. Stéphanie Léon, a neuropsychologist. Dr. Léon is a psychologist and clinical neuropsychologist in Ontario and Quebec, a graduate of McGill University with a PhD in clinical psychology from the University of Ottawa. She worked for several years at the Children's Hospital of Eastern Ontario, CHEO, as a neuropsychologist, clinical supervisor, and a research scientist. Now in private practice, she specializes in assessment and intervention of individuals facing complex medical and neurodevelopmental challenges. The objectives of this presentation are to explore the neuropsychological effects of hydrocephalus and spina bifida throughout the major stages of life: childhood, adolescence, adulthood, and aging. It describes frequently observed cognitive profiles and emphasizes intervention strategies, particularly cognitive therapy, to support daily functioning, mental health, and independence. By presenting concrete approaches tailored to each age group, the goal is to enhance understanding of these complex neurological conditions and promote comprehensive, integrated, and human approaches that serve patients, their families, and healthcare professionals. So, Dr. Leon, the floor is yours. Yes, hello, everyone. Thank you for being here today. So, we will talk about hydrocephalus and spina bifida with this neuropsychological perspective. I'll make sure I can go with the slides. So we talk about the objectives of the presentation. It's more an overview, but I hope each and every one of you will get something out of it and learn something. So I will start with an introduction to neurodevelopment to put things in context and talk about the difficulties in their context. So the brain development starts a few weeks after conception. So our neurons and synapses, connections between neurons, are formed by the brain at an extremely rapid rate since conception. So around the age of 2 to 3 years, the number of synapses reaches its peak. And then a processes of we call it synaptic pruning. I don't really like the word, but that's what we use. And myelination contribute to the differentiation of gray matter from white matter. So it's like if the brain is a bush and we have to prune certain parts of it that we don't need. So this is a process that appears around 2 to 3 years old, and also during adolescence. So the choice of which synapses to prune, so to cut, and which to strengthen, to keep, is kept on several factors, is based, on several factors. So which are those factors? There are several factors coming into play. So there's our genetic makeup. We all have a genetic makeup coming from our parents, but also from new mutations. And these new mutations, sometimes they have consequences, sometimes they don't. And we have new mutations adding up sometimes. And also there's the prenatal environment. So the medical status of the mother during pregnancy, was there a medication or drugs or alcohol taken? So these are factors that influence the brain development. Then there's the postnatal environment and experience, so after birth. So there's the temperament and attachment of the child, so attachment to parents or other caregivers. There's nutrition, sleep, medical conditions, and also the psychological, social, and economic context. So when we talk about the development, the cognitive skill development, I will talk about a typical and an atypical one. So the brain is divided into different anatomical regions. Each part has several functions and each part is interconnected. So think as the brain as a city. In the city, so in each part of the brain corresponds to a neighborhood in the city. So and each part of the city is interconnected with roads. So we can think about cars on the road being information being transferred from one to the other region. In a typical development, each region of the brain develops at its own pace. We have the motor regions that develop quicker than the frontal ones. So this is normal. So each region has its own rhythm. The difference with an atypical development is when the regions of the brain develop at different rates than normal. So we'll see regions of the brain that will develop more quickly or less or more slowly than normal. And also, we will see differences on how regions of the brain are not connected in the same way. So, in an atypical brain, the roads will not be the same. So, what is an atypical development? So, it depends on it can be injuries to the brain, it can be medical conditions during the or injuries during the developmental phase. We talk about neuroplasticity as well. This is something you've probably heard that the child's brain is resilient thanks to neuroplasticity. And since there are a lot of synapses that are created during childhood, there are a lot of changes and way more neuroplasticity. So the child's brain is more resilient to injuries and medical conditions than the adult's brain. So we used to think that because of this neuroplasticity, there wouldn't be a lot of impact, but that's not true. Because of this capacity to be plastic, the brain will take on this injury and maybe will not have a lot of symptoms or changes in the short term, but in the long term, there we will see effects, and we see that the child will continue to develop, but around this medical condition or this injuries, and we will see way more difficulties in the long term. In contrast, the adult brain, if there's a condition or injury, the adult during adulthood, so we will see a lot of cognitive deficits just after the injury, but little by little, sometimes will compensate better because the development of the brain is terminated, is finished. So there's a good foundation on which we can build to compensate the difficulty. So in both cases, there is an effect. The effects are different. No, not one is better than the other, but depending on the age when the medical condition or injury occurs, and we have different effects. Let's talk about neuroanatomical and structural aspects. As you probably know, spina bifida is a congenital malformation of the spine. The neural tube does not close completely during fetal development. For most people with spina bifida, most of these people will have hydrocephalus, not all, but in many cases. So we know that hydrocephalus will cause cognitive disorders and more than the spina bifida. So today we will concentrate more on the cognitive impact of hydrocephalus. Spina bifida is one of the causes, but not the only cause. So, hydrocephalus is a neurological condition related to an imbalance between the production and absorption of cerebrospinal fluid. So, the cerebrospinal fluid is essential to a good functioning of the brain. So, it envelops the brain, and also it's around the volume of the ventricles and and pressure on the brain tissue. It has a lot of roles actually, and it's essential. So the problem with hydrocephalus is that it leads to an increase in the volume of the ventricles and more pressure on the brain tissue. We'll talk about this more in the next slide. And this is caused by several things. It can be caused by tumors, meningitis, hemorrhages, head trauma, neurodegenerative diseases, and more. So, hydrocephalus by itself can be caused by several things, including spina bifida. But these causes, some of them are congenital, some of them are linked to development, but some come later in time. When I talk about cerebrospinal fluid, I imagine that the brain is like a big fish in a small bowl. The bowl is the skull, the fish is the brain, and the water is the cerebrospinal fluid. So the bowl is like the skull. So if we move the bowl a little bit, it's protect the brain is protected by liquid. But if we throw the bowl down the stairs, then there will be a trauma and it will create an injury. So this is something that fluid is something that protects us for small disturbances. So, what are the structure abnormalities and cognitive impacts? As we said earlier, hydrocephalus can lead to an increase in the volume of the ventricles, so a compression of surrounding brain tissue. What does this mean? It means that we have our brain, a little bit of this fluid, and then we have the brain tissue. And in these ventricles, what happens is that we have the fluid increases the pressure and the brain tissue is stuck between the skull and the ventricles. So if there's compression, this compression will disturb communication between neurons and alter the functioning of certain parts of the brain.
So the brain feels stuck between this hardened skull and the increase of fluid. The three regions most affected here would be the corpus callosum, which is like a bridge between two hemispheres. It helps in integration of processing of the information between the two hemispheres. It's very important. So if it's thinner, it will affect the integration and the speed of treatment. There is also the cerebellum, which is at the back of the bigger region of the brain. So it's a smaller region that protrudes to a little bit to the outside, but it's very important for motor coordination, but also for executive functions. We'll talk about what it does here. And the third region is the frontal lobes. So the ones that are behind our forehead. These are essential for concentration and executive function. What I mean by executive function are things such as organization, self-regulation, cognitive flexibility, and problem solving, as well as reasoning. So these are all functions that we associate with the frontal lobe. So these are the three regions most often affected. I just want to mention, when we think about executive functions, you can imagine that the frontal lobe is like an orchestra director. It is really here to plan, organize, other functions to make sure that everything works efficiently. So when the frontal lobe does not function properly, it will affect these cognitive abilities. So if we go back to the idea that our brain is like a city, the cerebral spinal fluid that should be under, as an aqueduct, but under the city, if it's not functioning properly, it affects the information on the roads and these cars, so these corpus callosum. But this does not affect learning necessarily. People with hydrocephalus will not be affected necessarily at this level, but it's rather in the speed and organization of doing these things. All parts of the city are present. It's just this capacity to access this information, to use it efficiently, that can be affected. Now we will speak about neuropsychological profiles and key issues according to age. We have spoken earlier about the factors that influence the neuropsychological profile. General factors such as the mother's health during pregnancy, postnatal factors, the environment, medical conditions, etc. Of course, all these factors will affect everyone in the neuropsychological profile. So others are specific to hydrocephalus. So things that are important to consider when we determine a person's neuropsychological profile and their cognitive difficulties relating to their hydrocephalus. So when the time of onset of hydrocephalus can affect this, if they've developed it in adulthood, it will be different than if they had it since birth. The severity might be different. There's regions that are most affected. We can see this with MRIs or other types of scan. Age or the time of treatment, the shunting, then the shunt will affect this. The effectiveness of treatment, if the shunt works or not, and the number of revisions or complications will have an impact. So all these aspects will impact severity or the number of cognitive difficulties experienced by the person. Now we can talk about the neuropsychological profile we can see in childhood as well as key issues in development. Oh, I wanted to add here that certainly with hydrocephalus, for some people, it will come with motor difficulty, visual difficulties, and possibly other neurological conditions. So when I'll speak about neuropsychological conditions for hydrocephalus, now I speak about it on its own, but we know that it appears with other things. It can change from one person to the other, how they are impacted with the visual or motricity. This can change from one person to another. So for example, if you have hydrocephalus, but also epilepsy, this has an impact on a person's neurological condition. So today I'm speaking about hydrocephalus on its own, but the person's profile will be complexified if there are other medical conditions to be considered. With the strengths in childhood, we see a normal overall intelligence, language and verbal memory that are in the norm, a good recognition of knowledge, and a good sociability. The difficulties that we see most often are executive functioning. As we said, it's because the frontal lobe and the cerebellum are affected, this has an impact on executive function. If you've surveyed the literature, you might have seen other terms like work memory, sustained attention. I won't go into that in depth, but in general, these all fall under executive function. This varies from person to person. It's higher with some. So there is a processing speed that can be affected as well. It can be less efficient. Visual spatial skills can be affected. I won't go into this in depth, but if you want to ask me a question on this later, why it affects visual spatial skills rather than with speaking. So this is difficulties with visual interpretation. Fine motor skills will be affected. Again, this is because of the cerebellum being affected. And in general, these children will have some learning difficulties. Key issues on what is important for these children, academic support and early intervention is important. Children with hydrocephalus can succeed very well in school, but they have to have a structured environment and an intervention plan with more time to do their schoolwork, support with occupational therapy with fine motor skills, as well as remedial education to support their learning difficulties. So this is to compensate any difficulties that the child might have with their condition while focusing on their strengths. There's a nonverbal learning disorder that may appear. This is not a diagnosis that is recognized necessarily, but it is a way to regroup all symptoms that describe the challenges that can arise with hydrocephalus. So this is the list of symptoms that may appear for these children. Those who have this nonverbal learning disorder, like I said, they can speak very well, but they have a hard time understanding space, maps, graphs, or construction sets. They know what to do, but sometimes have difficulty organizing the steps to do things. They do better in language subjects rather than in math, especially if it's based on geometry. They have slow or laborious handwriting, so they have to work on handwriting, and sometimes they have difficulty with subtle social skills, such as interpreting gestures, tone, or context. So they can be very sociable, they have friendships that last, but sometimes we see difficulties that are more pragmatic, meaning that everything that has to do with gestures or interpreting facial cues, there can be a difficulty in interpreting these facial cues, gestures, body language, actually. So it can affect social skills. So we should use a simplified visual structure without too many graphics, and rather use motor tools to write on the computer, for example. In adolescence, so there's a profile for every age, but the key issues will change. In adolescence, we continue to see a strength in acquiring information in linguistic form, again, maths, remains more difficult, especially if it comes with tables, graphs, things that necessitate visual interpretation rather than what is just mental. So calculus, that is usually easier. The impact on executive function is more noticeable because in adolescence, there is an increased need for time management, prioritization, flexible thinking. So the teen will have to use maybe planners, reminders, checklists, templates, technology to assist them here. And again, if we saw issue with social skills, with teens, we'll see it more, especially with girls, because there is more focus on social skills with girls. So the interpretation of nonverbal cues, perspective taking, pragmatic language can be difficult for some. So we should support them in working on their autonomy, independence. They may need career guidance, sometimes psychotherapy support to navigate social relationship and develop positive identity despite their chronic medical condition. In adulthood, they retain strong verbal skills, but many persistent challenges in executive, visual, spatial, and motor areas might persist. So there's different populations, those that have had development issues, and then those who start having a hydrocephalus in adulthood. So different regions may be affected, their history might affect their condition, but key issues that we see more in adulthood is more cognitive fatigue, especially during periods of stress when they must multitask. Sustained mental effort requires more energy. This is normal due to their slower processing speed and less effective executive functions. These keep increasing.
So this can affect the performance at work or at school. It can also affect social participation and interactions, but mainly mental health. Some people will develop anxiety, irritability, a low mood at adulthood because of these cognitive challenges. And this might have an impact on the job market or even when they completed school. So there is a variability here at adulthood as far as the job market. And finally, for elderly people, we see once again a similar profile, but we add that difficulties are added to normal cognitive aging. So three things will happen that we will all face or we already face. So there's a slide as far as aging. So this is gradual from the age of 50, 60, and then the decline is more acute after 70. So three things can happen. So there's a slight decrease in processing speed, slightly less effective executive functions, and decreased retrieval memory. So this is what we usually associate to aging. But as you can see the processing speed and less effective executive functions are already things that are affected with hydrocephalus. So people who have a history with hydrocephaly will be a little bit more vulnerable to these changes. And this can lead to a faster cognitive decline. So possibly instead of starting to have problems at age 70, then it's more at age 50 or 60. So I have difficulty keeping my rhythm. So the all these changes will appear a little earlier with people who have hydrocephalus. And let's talk a little bit about areas for intervention and support for people who have hydrocephalus. So, what is the role of the neuropsychologist? My role is mainly to assess cognitive functions. So, we look all the spheres where we know there might be difficulties, but also other spheres. We will look also at the strengths that are there. And the assessment will help us to identify strengths and difficulties of the person. And as I was saying, each person has its own profile depending on the prenatal or postnatal and medical condition. So we'll assess what is his profile, and then we'll do personalized recommendations for school work and daily life. And this includes strategies, organization tools, accommodations. In certain cases, we will do cognitive therapy. This is teaching effective compensation strategies. So the primary goal is to support independence, learning, and social participation by building on the individual's strengths. I wanted to talk a bit about cognitive therapy. Cognitive therapy it has several aspects to it. So it aims to strengthen cognitive functions and develop compensatory strategies tailored to the individual's needs. So we really, really look at these two aspects. So as far as cognitive functions, we want to strengthen them, right? So what do we need to strengthen these cognitive functions? Everything that's good for the brain, we want to use on a daily basis. So to strengthen the brain. So healthy diet, restorative sleep, a daily physical exercise, have a good social participation, good stress management. We know that stress hormones have a negative effect on the way the brain functions. And there's also the predictable routines. The brain adores repetition. So when we have good routines in the morning, at night, when all these routines, if we go and to the same job and take the bus at the same place, same time, etc., these routines are so well integrated that it actually retrieves uh, men- mental load or brain load, so the brain can function better. The other thing that we teach is a technique called pacing. And it's the idea that consistency is better than performance. So when I work with people who have cognitive difficulties, we may start at a functional level that is a little bit lower than what the person can keep, but we want to maintain it. So we want to increase the functioning. It's like large steps, large constant steps, so small increases in time. So, and in the long run, we actually improve the situation. We don't want to have a functioning that is going up, big ups and down. Oh, today was a very good day. I did a lot of things, and then we have a crash and burn, and the next day we can't do anything, or we can't do anything for several days. We have migraines, we can't concentrate, we cannot go to work, and we have to get away from work for, and then we have a good day again, and then we do a lot of things. So we don't want this way of functioning. This is a way with ups and downs, and it actually reduces the functionality of the person in time. So this spacing technique allows us to increase on the long term the way the person functions, and to really get full potential of the person. And another thing I didn't put on this slide is all these things we can do to reduce the impact of our secondary medical conditions. For instance, it doesn't have to be linked to hydrocephalus, but for instance, diabetes. Diabetes will have an impact on cognitive functions. So we have to treat well our secondary conditions to increase our cognitive functioning more broadly. So we really want to optimize our cognitive functions when our brain feels it's in a secure place. It slept well. It went outside. We had physical exercise. We had sun. We had a healthy diet. So all this optimizes the functioning of the brain. So we will work way better in these conditions than if we didn't do all this and didn't take our medication, etc. So this is for everyone, but particularly for people who have cognitive difficulties, for all, whatever the reason is. The second part, so we look at compensatory strategies. What is that exactly? We make sure to put our brain in a context that will optimize its performance. So we will maybe look at our strengths to sustain and support our weaknesses. If someone, for instance, has difficulties with attention, concentration, organization, we will prepare the space, make sure maybe the, there are not too many visible objects in the office, not too many stimuli. We want the place to be calm, especially on a visual level, because it requires a lot of energy. The visual aspect requires a lot of energy. We will also use verbal, auditory, or tactile cues rather than complex visual ones. So, very often, and it's very common for a lot of the recommendations we do for other conditions, we will add visual strategies. But for hydrocephalus, this is not a good thing. So we will add tactiles, verbal, auditory cues, but not visual ones. So what will this look like? One thing that I teach is internal verbalization. It's a little bit like a narration of what they are doing. And for instance, if there is a certain task, okay, today I will do this. Okay, should I do first? And what is the second thing I should do? And this will help the person to hear because they say it. So it's the verbal part that is activated, and then it's auditory as well. So it helps with organization. So this is a technique that can help also at work or school. Uh, we allow for extra time. Very often at school, it's a strategy that can be given quite easily, but it's also important to give extra time at work as well. So it might take more time. It's not that people cannot do these tasks, it's just that they need more time to do them. And maybe make more cognitive breaks, especially if you have migraines. If you can have like cognitive breaks sometimes to refresh, it can be very, very useful. and also work in a domain where there are structured tasks. So we like predictable, constant, repetitive tasks. So this is really important to maximize this, to remove some of the load, cognitive load. We also want to favor a slower pace. And we've talked about this with family as well. Maybe do things a little bit more slowly, not because the person cannot do it or is not intelligent, but because the person needs more time to process the information and go through the information because these roads have been affected. So before the person can respond, if, for instance, we talk about decision making with hydrocephalus, these people with hydrocephalus, sorry, will uh, be able to make decisions, of course, but sometimes it takes a little bit more time. So for caregivers, for the family, we have to favor a bit of a slower pace. So favor also simple, sequenced instructions rather than long instructions that are difficult to remember. So we don't come and say, okay, you need all of this today. No, we start with this, and then when you're done, come back and I'll give you the next task or the next instruction. So this is something we do a lot with the children, but very much less actually when we are at work. So these recommendations are important for workplaces. Also, we need to use very concrete checklists. For instance, instead of having a very small list of, okay, today I need to tidy up the room, instead of doing only one thing, sometimes it's not concrete enough. So we will divide it in a small portions so it's even easier to do. So tidy up the room, it might be, okay, I have to pick up the clothes. And then I put all the clothes in the basket if they're for laundry. And then I do my bed and really separate all these tasks. Because what does tidy up my room mean? Maybe that's too vague. So we need to separate it in small steps. It's way more concrete. So this is an example for tidying the room, but it can be for a project.
So you also have to be aware of the person's variation in mental energy so that demanding activities can be planned for when the person has more energy. So if you are thinking of going out of the house, you should do it in the morning if you have more energy in the morning. If you have 3 activities you want to do on the weekend, you can do them all on the Saturday, for example, and none on the Sunday. It's better to do just one activity per day. I won't go out to go to the bank, the postal office, and do errands. You just do one at a time, one per day. So you might feel like it's more efficient to do everything on the same day, but it might be too demanding on cognitive abilities and cause on the long term more issues. The last part I wanted to speak about is psychological support. This is for both parties, the person who is affected, but also for families and caregivers. So for the person who's affected, this will help them understand and adapt to the diagnosis and the progression of the condition. This will support self-esteem, will help them manage stress, whether it be with medical care or functional changes. It will give them support with the transition to autonomy, especially for teenagers. Uh, and it will help them become more autonomous at every age for all the way to adulthood and more elder years. For families and caregivers, psychological support can help them with emotional support in the face of worry, uncertainty, and daily stress regarding the person who's affected. This support for family is for adjustment and communication. This prevention of burnout, which is an issue that can be affect many caregivers. Referrals and resources and support services in the community can help here. So I'll go over quickly the last part to make sure we have time for questions. So hydrocephalus causes neurological and cognitive challenges related to pressure on certain areas of the brain. Cognitive profiles are often uneven, with well-preserved verbal abilities and difficulties in visual, spatial, motor, and executive functions. The evolution over time is not necessarily with the profile, but the issues regarding this. But in general, autonomy, learning, social life are things that have to be considered because they can impact many fields. Interdisciplinary accompaniment should include, despite all the changes we see in our healthcare, ideally, there should be support with neuropsychology and psychology. And we should focus on everyone's unique strength to ensure good quality of life. You've noticed maybe as I'm speaking that I speak more of functioning than improving cognitive weakness. For me, functioning in daily life is more important versus scoring better on a test. That's not necessarily the objective. We just want to improve functioning so that the person can have a better quality of life and participate more actively in their community. So that's it. Thank you so much.